Dr. Del Pozo, Dr. Lawson, and Dr. Latifat. Welcome to the GI Health Summit. Thank you all so much for being here.
Thank you for having us.
Can't wait to talk to you guys. So I'll start right away with the question, why does it seem like food is the culprit for symptoms of irritable bowel syndrome? And can we change this to actually using food as healing?
Jess, go ahead.
This is a great Dr. Lawson question. Got motility and
Yeah, sure. Well, when we put food in our stomachs, we generate lots of reflexes that are either hormonal or nervous induced. And in irritable bowel, those reflexes are amplified. And so patients tend to see these foods as an enemy, something that's going to cause cramping or bloating or gas or diarrhea because of these heightened reflexes. And part of it is the way they're wired. They're wired differently, as Dr. Del Pozo knows better than I do. They have a way of allowing way too many nervous inputs into their brain, and this creates a shutdown and this heightened reflex activity that causes all the misery of irritable bowel syndrome. And we found that it was very prevalent in children, and we found that if we could intervene and somehow stop that information overload by working on stress, exercise, education, diet, and sleep, we could make a difference. We didn't cure anybody, but we attenuated the symptoms so that they were much more livable.
Because, you hear a lot of times little kids often have a tummy ache. And so how does a parent know, well, is it just something they ate, or maybe it's something more serious and they need to see a gastroenterologist?
Absolutely. It's very important for them to make sure they're working with their doctors as parents. And a lot of us, actually all of us on the video today are parents. So we definitely understand that the impact that our kids being distressful can cause on the parents. And you're always wondering if it's something horrible or not, right? So when you work with your doctors or your healthcare team, whether that's a nutritionist, mental health, and they've done diligent work in making sure it's nothing dangerous, it's really important to understand that the GI tract is the second brain. Right? We spend a lot of time, our body spends a lot of time in digestion. We cannot live without food, right? So the bottom line is our GI tract is constantly working, and that can be in adults and also in kids. And, like I mentioned, it is the second brain. So things like stress can affect the GI tract. Not sleeping well can affect the GI tract. Our mind work can affect the GI tract. So again, it's important to make sure you work with your healthcare team. But really all those things external to the body can cause GI symptoms. And we really have to take a bigger view of wellness to make sure that ourselves as parents and kids are healthy.
You mentioned diet, sleep, and exercise. And like when I was a kid, I never heard those words. I'm 60, by the way.
Okay.
Different times, right? You look fabulous.
Oh, thank you. But Dr. Del Pozo, kids, it seems like it's more stressful to be a kid today, just in general.
I would say so. And it's hard. It's hard for parents to know, right? How much screen time is too much? How much structure is too much? And it seems that the combination of little structure, a lot of screen time, the habits of eating, you can enter from anywhere and get improvement. A lot of criticism with a lack of structure can be a difficult combination. There's so much stress with parents being together, apart, together, and in conflict, changing schools. Just going to the school lunchroom can be a really intimidating place to try to digest food for a kid, even if it's not a new school. Skipping breakfast is very common, and then really overeating and binging on delicious junk food after school is a common pattern that we've seen with the kiddos.
I don't know what it's like because I don't have kids, but when I went to school, they didn't even have doors on the bathroom. And it's like, how does one feel comfortable even going to the bathroom when there's not a door? Do they now have doors on the bathrooms in schools? Because they didn't when I was growing up.
As far as I know, yes, but it can still be a scary thing to leave class if other kids know that you're leaving because you have diarrhea or you need to use the bathroom. And so we try to encourage in general when school is in session that kids go to school with a tummy ache unless they have other symptoms like a fever or something else where their primary care doctor is saying they should stay home. But if it's kind of recurring tummy aches, you take that pain with you and you carry yourself gently through the day, lots of breaks and making it easy and supportive for them, but keeping them in their general routine. If something is really distressful to them, on occasion, they need to talk with someone about that and make bigger life changes. But most of the time, we want them to stay plugged in and just increase their coping skills.
I mean, it's hard enough being an adult with GI disease, but to be a kid, it must be really difficult.
And we found that in our program that when we got the kids together, we have groups of, say, 6 to 8 kids. It was very reassuring for them to look around and see these normal-looking kids with all the same problems that they have. And I'll never forget one little guy said to his mum in front of me, "Hey, Mum, I don't feel like I'm a freak anymore." And I think that group therapy is very powerful.
I know that in adults, often one of the symptoms of IBS, and sometimes if they have SIBO too, is bloating. Does that often also manifest in children? Because I could imagine that could be embarrassing. And, kids are not always nice to other kids. They tease them. And, because I've seen adults bloat men that, like, when they have an episode, they look like they're 9 months pregnant.
That's a great question. And interestingly, kids don't tend to bloat as much as adults. Maybe their stomach muscles are tighter, who knows, but they mainly complain of nausea and maybe throwing up and diarrhea as well. And it's interesting that this condition is very, very frustrating because it doesn't show up. It's like a migraine headache. It's very real. There's no question about the symptoms, and we never question the symptoms. We reassure the kids that we understand that they are suffering and reassure the parents despite the fact that all the tests are negative.
When I think back, before, we had functional medicine doctors, I can imagine so many kids were just told, "Oh, you're just nervous. It's in your head. You have a stomach ache." And they were dismissed just the way many adults were dismissed early on.
You bring up a very good point, which is it's not a question of whether it's in their head or not, because we know it's not in their head, right? We know that the body is powerful. We know that our nerves are powerful. And even though we cannot see it as physically as the arm, doesn't mean that it's not there. And it definitely plays a huge part in the impact of the symptoms and also the burden of how significant it feels in the lives of the people that are affected. So I agree with you 100%. It's not in people.
And we have some catchphrases that we teach to people in the classes. It's not in your head, but your brain has a lot to do with it. How you're taking in and processing information. And it's very real, but it isn't life-threatening. And so the reassurance comes that it isn't life-threatening, and we can do a lot being uncomfortable. In fact, it's better if we stay engaged in our daily activities, paying attention to our symptoms, but not letting them rule the entire day.
Right. As I mentioned, I was born in 1960, and I didn't grow up eating the best diet. That's when a lot of processed food was coming into play. Remember, Space Food Sticks and Tang and Pop-Tarts and all these processed foods. And it seems that kids today eat even worse than I did. And schools do not always serve healthy lunches.
Yeah, absolutely true. And we found that, the kids, as Dr. Delpozo said, they tend to skip breakfast, and when they get home, they gorge on pizza and Coca-Cola. You couldn't imagine anything worse for the GI tract. Fat is a much more potent stimulus of a lot of these enteric reflexes that we talked about. And these kids have a very sensitive GI tract. We use the term visceral hypersensitivity. Simply put, that means if you put a balloon inside the intestine of someone with irritable bowel syndrome, they'll feel that balloon at half the volume. And in experimental situations, when you add stress, you don't even need half of that volume to cause the same amount of discomfort. And so these foods, especially high fructose corn syrup foods, tend to generate a lot of gas. And most of us can handle a bit of gas, but when you've got irritable bowel syndrome, it feels like a ton of gas, and it doesn't move as readily as it should. So, these types of approaches to diet have generated interest in this diet called FODMAP, and we could talk a little bit more about that perhaps, but it has had some benefit in a lot of irritable bowel patients.
My understanding, though, is you cannot follow the low FODMAP diet forever. That even one of the doctors on the summit said long term it could actually cause nutritional deficiencies.
That's absolutely true. And I think only half the people stick with it. And that's why we took a more sort of multifactorial approach to the kids. Yeah, we include diet in the program, but we also stress, sleep. And thankfully, Dr. Del Pozo is an expert on sleep, exercise, and education is very important, giving the kids credibility, knowing and sort of appreciating how they feel.
The dinner table can be a really stressful place where everybody's home from work and home from school, and there's kind of an amped up feeling sometimes, and everyone's maybe wanting something different to eat, but the pressure comes with, how was your day? How was the test? Rather than just being in the moment and, focusing on how we eat and setting up the scenario rather than the TV on in the background, having, pleasant, relaxing music and having it be a calm place to digest. It's often a real point of contention for families if they're even together at that time.
Many of the experts on the summit saying that fiber is really important for the gut microbiome, and yet so many kids today eat not just few fruits and vegetables, but none. And I believe Congress now said that ketchup was a vegetable, they can put it on their French fries. And so a bigger question is, how do we get kids to eat these healthy foods, whether they have GI disease or not? Because this is so important.
I think a lot of it starts at home, like Dr. Del Pozo was saying at the dinner table, and what options are being made available, right? And what our concept that we're teaching to our kids as good food is. I was reading a book recently that had pictures of yummy foods versus yucky food for little kids, and the yummy food included things like pizza and juice, right? So it's what kind of information are being extended to our kids directly, but also through parenting. And I agree that fiber is great in general. However, there are different forms of fibers, right? Things as simple as adding spinach into their smoothie can go a long way, right? So there are things that don't necessarily have a horrible taste. And also when it comes to taste, it's acquired, right? When we teach our kids that eating things that are high in sugar is what delicious is, their brain gets a message that is delicious. So a lot of it definitely start at the dinner table and even breakfast with parenting, and how we can definitely influence our kids' palate and what their definition of delicious is and what educational materials we're exposing them to. I think that's really
I agree with you. Taste is acquired, and that's why it's so important for mothers to get their diet in order before they even have the kids, because people that eat healthy love eating healthy, and it is often sometimes more difficult to change the palate, but it's possible. And I love your idea of the smoothie, because this stealth approach to hiding vegetables in foods, like putting more in marinara sauce with familiar foods, it can actually help. You had mentioned visceral hypersensitivity, and I remember hearing about this test. It's so interesting to me. I would love to have it, because I've suffered from IBS for years, and I always say I'm like Princess in the Pea, where like I feel things more deeply. And I'm wondering, with the children with the IBS, in addition to this visceral hypersensitivity, do they also have just sensitivity in general?
They do. In fact, it's very common to see migraine headache, and in adults we see TMJ, fibromyalgia, as well as poor sleep patterns and fatigue. They sort of come together as a jigsaw puzzle. Everything starts to fit. And it's just because it's not just the gut that's on information overload, it's the whole body. And the whole body is very sensitive. And what was interesting, I was a bit surprised that in kids, we don't quite see the whole gamut of those things, but we often see some of them, migraine being very common amongst kids with IBS.
Interesting. Can somebody request this test? And I'm wondering how, and the people that don't have IBS, why would they even want it?
I have a sigmoidoscopy without any medication. That'll tell you you've got visceral hypersensitivity. Yeah, Dr. Latifat's laughing, but I'm 70, and I remember days when we used to do that test, and you could tell who had irritable bowel, AJ. It was very obvious.
Just going to add a note to what Dr. Lawson was saying, and one of the terms that we like to use is allostatic load. So it's kind of looking at the whole picture of this child in their family, in their community, in the world at this time, and what's going on in the background. What's the whole picture going on with this person, rather than trying just to look at the mechanics of one person's gut. We want to look at everything going on around them.
I'm thinking if a child has to be on a special diet, and we're bombarded with so much dietary advice this day, not just low FODMAP, but gluten-free, paleo, keto. And if a child does have a GI disorder and has to be on a special diet, I could imagine they might feel different. And especially if there's other children in the family or at school, they're not getting to eat those same foods. So it must be difficult to explain this to a child that wants to eat like their friends.
Yeah, that's correct. And I think it's important to state that there is no specific diet that fixes IBS. FODMAP diets are just designed to reduce the gas in the intestine. That helps. And, you're right. It's very hard to comply with these strict diets. They don't last for very long. So, and I think what Dr. Del Pozo is saying, it's often the setting in which you're eating that controls or produces these symptoms. And again, that's why we took that multifactorial approach, not just focusing on diet. And I found over time that patients can be a bit more liberal with their diet once they get all the other things under control. The stress, the exercise, the sleep. They're important factors to treat when you're trying to get someone to get better.
Right. Well, in your book, The Gut Solution, your book, which is for parents of children with IBS, you talk about the placebo effect. Why is this important? What is it, first of all, and why is it important?
I think, well, let me let Dr. Del Pozo explain. I think she has a good way to do that.
Placebo for years was kind of referred to as a fake effect of, from a fake sugar pill or another phony intervention of some kind, surgery or something else. But really, it's a real response to something with an inactive ingredient. And there's an old MASH episode about that using morphine, which worked for about half of the soldiers, on the MASH unit, who they ran out of medication. And it's something, how we can kind of sum up what we understand about it is when help is on the way, or when we feel that we have agency in our life and we can take some kind of control, or we're taking something that can help us, the smart brain body starts to shift immediately into more of a healing place. And so it's a real response to a so-called, faux intervention. And we're all susceptible, to it. And that's a good thing. It ruins plenty of pharmaceutical clinical trials for medications because placebo often works almost as well or as well as certain medications. But it really is pointing at the natural ability of the body to shift and refocus and heal itself.
So talk a little bit about the gut microbiome, why that's important even in children, and how can they optimize their gut health?
Well, let me let Dr. Latifat say a bit about that.
Yeah, gut microbiome it's very complex. And I believe it's actually a blessing that we sometimes think to not be a good thing, but it actually is, because your gut microbiome affects how certain vitamins in your body is broken down. And we're having more and more data, and we need to learn more. We'll continue to learn more about truly what the impact or the consequences are, right? But we know that there are certain things that affect your gut microbiome. There are things like your diet, things like stress, things like sleep. All of those affect your microbiome. What you're eating affects your microbiome. We know that when we're leaner versus when we're on our heavier set of our normal, there's a difference in our microbiome as well. So it's really important to understand that. And it's not just the microbiome causing issues or health issues, but it's also all those things actually impacting our microbiome as well. So making sure we're getting our prebiotics, our fiber, those are all important. Helping our body have a good balance of bacteria using things like probiotics if needed and if indicated can also be important, right? So I always tell people that when we have things that are not meant to be our body, but we're feeding our body with it, that can definitely cause imbalances that doesn't only affect our GI health, but also other parts of our overall health.
What should we be teaching our kids about gut health?
We should be teaching them that good health is about our diet, it's about our sleep, it's about our being outside and running and being well and interacting and fighting and having conversations and just understanding that life is not perfect, right? Because what we know is that we talk a lot about the brain-gut connection and the impact that our brain has on our health. And when our kids understand that it's normal to not be happy all the time, that actually affects their GI health. When they understand that things that are high in sugar doesn't mean that it's good for you, that actually impacts their health. Knowing that, having issues and having conversations at the dinner table and how to conflict resolve, that all affects our GI tract. And I remind people, and Dr. Lawson is smiling because I cannot tell you how many clinic visits we have where people have abdominal pain when they're fighting with their spouse, right? Where, people have abdominal pain on Monday mornings on their way to work, right? So all this if there's anything I would recommend that people take away from here is the fact that our GI system is not this isolated island where you're talking about your GI tract being well. Your GI tract being well is a reflection of your entire health being well, your mindset, your work-life balance, your joy in life, your giving, and all these other things that are just as important as anything else you get in my clinic. So.
I love that what you said about how they have the stomach ache Monday morning. I can think back to the one job that I absolutely could not stand my supervisor, and I had a stomach ache the entire time I worked there. No doctor could have helped me. That's
What's
great.
interesting about that, AJ, is when we try to have classes during vacation time, kids would never show up. They showed up as soon as school started. And that's one thing to add to what Dr. Latifat said is that we are role models as parents. And studies have shown that the more mum goes to the doctor, the more the kid will go to the doctor. And I think it's very important that we show good health to the kids, and they'll tend to follow us.
When I was little, we actually went outside and played and we got dirty. And now today, everything is super sanitized. And I heard that's not necessarily a great thing for our gut microbiome to be this clean all the time.
I think there's some truth in that. For example, peanut allergy is a good example where in Israel, where kids are given peanut butter at a very young age, they hardly ever develop peanut allergies. And the Israeli allergists can't believe how much we see peanut allergy in kids in Western society.
Yeah, one of the patterns that we see is this avoidance, avoidance of a certain food or avoidance of food altogether. And because it seems like it's causing distress, and really it's just kind of that tip over the edge that the body's having a hard time digesting because of everything else going on. And like the peanut allergy example that Dr. Lawson gave, we don't necessarily want to avoid something because it seems to cause harm. We want to just look at it more carefully and be curious about that. We don't want to avoid school because school is stressful. We just want to look more closely at it and, kind of look at all the factors that might be contributing.
I'm wondering if the pandemic in general has been more favorable or less favorable for people with GI diseases, because for some people it actually has created less stress and for some people more.
I will agree with you 100%. Definitely people that are more sensitive have been struggling a little bit more just because of the mental and mindset part that the pandemic has been inflicting on people. However, in people that have stressful work environments, this is the best thing that's ever happened to them. So it's a mix for sure.
Absolutely, because my job used to require me to travel all the time, which is something that I never enjoyed. And so this has been very good for my gut, but obviously not for everyone. So what's the best treatment for IBS in general? And does it matter of the age if it's a child or an adult, or is treatment pretty much the same?
Well, I think it's a great question. And I think, again, the multifactorial approach seems to be the best approach. If you look in the literature, what we did and what people have applied to adults is equally effective. Medicines, as Dr. Del Pozo alluded to, are limited because the placebo effect can be present in about 40% of patients. Now, to get a drug through the FDA, you only have to prove the drug works in 50% of patients. 10% better than placebo gets you, through the FDA and onto the market. And a lot of these drugs have side effects, and many of them are hellishly expensive. The only drugs that I feel are really great benefit are the ones that help you sleep, that aren't addictive, and that can block some of these pain pathways that Dr. Del Pozo alluded to. But again, if you look at the old data, education and reassurance is very, very effective. A study done in the Mayo Clinic many, many years ago by Nick Talley showed that when the doctor took time to explain the condition and its relationship to stress, those patients had less depression, less abdominal pain, less likely to call back and less likely to come back. And I think this doctor-patient relationship is vital. Just sticking scopes in people and telling them they don't have cancer is no way to treat this condition.
I think it needs a better name because people don't like things that have to do with, stool or bowel. I think there needs to be like a PR firm that like kind of rebrands IBS with a better name. And I think patients might be able to accept the diagnosis better,
Well, functional bowel disorder is another way to explain it. But when you say functional, you're sort of implying you're imagining this. It's not real. I don't think that's a good thing.
Yeah. It's just, I find anything that has to do with pooping or bowels, or if people they just are embarrassed, they're ashamed. At least in the adults I talk to, a lot of times they don't even go to the doctor. Even constipation and in diarrhea, especially, these are embarrassing things. And people, that's one of the reasons I'm doing the summit is I'm trying to make pooping like norm. I'm trying to normalize pooping, especially for people that don't have normal poop.
Yeah, well, about 30%, up to 30% of our population have had episodes of incontinence. And it's very prevalent in patients with irritable bowel syndrome. And it's important to address that and ask the patient if that is a concern, because this keeps them at home and makes them depressed, and there's ways to treat that. And I think that's an important issue to bring up with patients, even though it's uncomfortable to talk about.
Part of the magic of the class is someone who isn't here. Monica Randall was a dietitian that taught with us. So we really had this multidisciplinary approach. And she was so good at putting everyone at ease and talking about poop and farts and, just putting it out there. And once we kind of could shine a light on it, so to speak, it really did destigmatize it. And I do think that you brought up a really important point, and that you taking the shame out of it is so important to move toward healing and not making people more anxious. They're already kind of prone toward anxiety, and now they have anxiety about anxiety. It kind of doubles the problem.
I mean, especially now with it being so prevalent. What are broad strokes?
The broad strokes of wellness, we really are, it's summed up in the acronym SEEDS, where it's stress management, education, exercise, diet, sleep. And if we can add another S, it's socializing, it's connecting with others and finding our purpose, finding meaning in life. Those are the broad strokes.
What do kids do when they have a flare-up? How do you advise them?
And we mentioned it a little bit earlier, of just slowing down, but staying in their general routine. Having a flare-up plan where, on a really bad day, what are those things that are going to support yourself? Who can you call out to? Can you still go to soccer practice or something else, but maybe not go 100%, but just stay kind of plugged in and gentle with yourself, but continue through the day.
Just wanted to add to that. I don't think we can overemphasize the importance of parental education and also wellness for the parents as well, because the kids can feed off of the level of anxiety or anxious the parents are. So we find that the more well compensated in that way, quote unquote, the parents are, the more likely, the better the kids are able to do. So taking all that, but also really empowering the parents so that they can set the tone. Because what we're communicating is not just the words we're saying, but the unconscious messages that we're passing on to the kids as well. And this is a very important factor.
A lot of diseases run in families or are genetic. Do you find that's the case with certain GI diseases, especially IBS, that if a kid has it, it's often a sibling or a parent also has it?
Well, there was an interesting study with identical and non-identical twins done in Seattle. And what they found is that there was about a 20% concordance in the monozygotic twins. That means if you're a twin with identical DNA has IBS, you have about a 20% chance of having it yourself. However, when they looked at the non-identical twins who don't share the same DNA, it was more important if the mum had IBS than if the twin had IBS. So I think it just suggests that your environment is more important than your genes.
And what you believe about yourself, what you believe about, is it a catastrophe to have these symptoms or believing that it is something that you can learn to manage without dismissing it or catastrophizing, but finding that middle.
Is IBS the most common GI disorder you see in children, or are there others? And if so, could you talk about what some of the other ones might be?
We do see inflammatory bowel disease, and I'll let Dr. Latifat talk a little bit about that, Crohn's and ulcerative colitis, because sometimes they do tend to mimic irritable bowel syndrome, but usually it becomes pretty obvious over time what it is.
Yeah, I agree. In my practice, I see people over the age of 18. So by then, they're fantastic pediatricians, and GI doctors have already done a great job in making sure that there are no, there's inflammatory bowel diseases. Those are already ruled out at that age. But absolutely, IBS is extremely common. In fact, I tell people that we all have a level of IBS to an extent, right? If I eat something that doesn't go well with my body, I'm going to bloat. If I have stress in my life, I'm going to bloat. If I go past what my healthy range of normal for my weight is, I will bloat. So it's also part of it is remembering that it's our body's way of sending messages to us to try and change something. So remembering that the pain itself is not a sign of alarm, but could be a sign of, all right, maybe not this one, maybe not this time, maybe a little bit more rest. So we all have IBS to an extent. It's just more high burden in some people than others.
You mentioned about having a favorable weight. When I went to school in the 60s, maybe in a class of 40, there would be one overweight kid. Now it seems like at least 1 out of every 3 kids under the age of 18 is overweight or obese. How is that affecting their GI health?
Well, in general, it's more common in overweight kids. However, I had this preconception that when we set up this class that we were going to see a lot of overweight girls in the class, and that was not the case. We saw a lot of very fit kids, a lot of high-level soccer players, a lot of swimmers who competed at a very high level. And in fact, if you look at college athletes, the worst IBS occurs in rowers. So it's not the only factor. And exercise is very key to improving irritable bowel symptoms because exercise generates endorphins. These are our body's morphines that float around our cerebrospinal fluid and bathe our brain and block a lot of those pain pathways that give the discomfort that these patients suffer.
Some of those high-level athletes will work on reducing and managing perfectionism because they're at one end of the spectrum. And as Dr. Latifat said, we want to look at this as a spectrum, a continuum of health and disease that we all oscillate on throughout our entire lives.
When I was, I believe, in junior high, they stopped physical education in the public schools. And today, sometimes this is the only exercise kids get. I can't imagine that's good for their health in general or GI health in particular.
I agree with you 100%. It's not good for any one of us, kids or adults. In fact, when I take care of older adults in the hospital, we know that the less mobile you are, the more you sit down in one place, the weaker your muscle gets, right? So it's really important for adults, kids, and again, and exemplifying if the entire family is going for a walk. You're not pointing fingers at the kids. We're truly leading by example.
I've heard from some of the experts in this summit that most Americans eat something like 92% of their calories from animal products and processed food and less than 10% from fruits and vegetables, which means that most people on the standard American diet are on pretty much a virtually fiberless diet. And constipation is a big problem. And I see so many adults that have had constipation their whole life. Is having constipation as a child, can that set you up for future problems? Because I know that without eating fruits and vegetables, a lot of these kids are probably not having regular bowel movements.
Well, that's correct. Encoparesis is a condition that plagues kids where they're too busy to go to the toilet. They generate a big stool in their rectum. When they try to pass it, it's painful, causes fissures. They start to see a little bleeding. And those kids are definitely predisposed. However, this is a pervasive condition. I've worked in many places around the world, Cambodia, Nicaragua, Singapore, and you'll see it everywhere. And so diet is obviously a factor, but there's more to it. And maybe it's just a big spectrum that we don't really understand yet. Maybe there's other, we could sub-classify it more than we already do.
Why do you think a multifactorial approach to treating IBS is the best approach?
Because it's the most successful approach. And the reason why, again, is we have to start defining our gut health as wellness. And IBS in general, it's a syndrome, meaning there's more than one thing in that bucket, right? So some people, it's more of the dietary. For others, it's more of the stress. And when I say stress, I want to make sure I'm pointing out that I'm not just talking about anxiety or depression, where people assume that if I'm not anxious, if I'm not depressed, I cannot have IBS. So not the case, right? When we worry, that can lead to changes in our microbiome. So definitely working with your nutritionist is important. Working with your psychiatrist or therapist is important. Your primary care doctor. But even more than that is just being active and being a normal, regular person in the society that understands and believes that life doesn't have to be perfect.
And patterns of brain activity are very similar in people with chronic pain issues like fibromyalgia or chronic pancreatitis as they are in irritable bowel syndrome. So there is a sort of a common pattern here. If you look at brain activity, there's areas that just let too much information through. And so the body gets on information overload, but it's not specific for the GI tract. And that's why, again, we see migraine headache, TMJ, fibromyalgia. All these things are very common in patients with irritable bowel syndrome.
And why exercise is so important, like you said, because if this is the only exercise, there's immobility in the body, but there's still stress going through the brain, and it has nowhere to kind of act that out physically. So movement is really key.
I've been hearing motion is lotion. So, yep.
We should talk a little bit about meditation as well, because we use that in our program with the kids, and self-guided imagery has a lot to benefit people with IBS. And there are websites and apps you can go on and learn that. It's a very simple technique to relax the body and it really helped the kids. We gave them a CD-ROM to take home, and they played it to help them sleep, or they played it when they were having a flare. And that's one way to try and treat a flare, is to just relax and go to another level.
I'm learning from this summit that at least with adults with IBS, there's often other comorbidities. Sometimes there's hormonal problems or, hypothyroidism. In children, is that also the case, or is that just usually the first thing they get when they go to the doctor and don't really have any other problems?
What we found is that these kids go through what's called a crisis year. So when they actually present and are diagnosed with irritable bowel syndrome, they're having a lot of other visits, and particularly mental health visits. They were very prevalent. So, and the kids that had more mental health visits were the kids that tended to continue to have IBS even after the program. So we had more success than the kids that had less mental health visits. But kids, were going to the ER and having CAT scans, and this is not a good thing for a young developing female to be irradiated, and we know in the long term this can be very harmful. So yes, I think, and what we do find with adults is that adults are 3 times more likely to have their gallbladders out, twice as likely to have hysterectomies, 50% more likely to have back surgeries. These comorbidities lead to a lot of interventions that they don't really need. And in fact, we probably see a mortality rate of about 6,000 people a year from unnecessary cholecystectomies, so gallbladder removals. So I think it's a real problem, and we have to see it in the big picture. It's a very expensive condition to manage if you go overboard with all these tests and unnecessary surgeries.
Like you mentioned earlier, it has a stigma to it. It doesn't have a flashy name that really can pinpoint how much someone is suffering. So I think it too needs a rehaul, and kind of have its reputation rebuilt to understand better what we're dealing with.
So I guess the question I'd like to ask on behalf of parents that are watching is, how do they know whether they should seek medical care for their child? I remember growing up, I'm from a family of 4, and it almost didn't matter what happened to us. I was actually hit in the head with a baseball bat, which today I would have had an MRI, but my parents, you're fine. Shake it off. It really, we never went to doctors. I mean, we could be bleeding. They just say, you're fine. That seemed to be the attitude back in the 60s. But so how does a parent know if a kid, maybe has a tummy ache because maybe they're nervous about a test, or a little bit of constipation or diarrhea, if they should shake it off, or when should they seek medical care and how often? And do they go to the pediatrician first? Do they go right to a GI doctor? So if you could just give advice to parents that are dealing with kids with tummy troubles.
I would say that if your kid is waking up in the middle of the night with GI symptoms, that is something that should definitely make you seek medical attention. If they're having diarrhea, they're waking up in the middle of the night with tummy ache, they're having bleeding. Those are definitely not IBS until almost never IBS. However, during the day when your kid is having abdominal discomfort or any of the symptoms we've discussed today, it's important to ask yourself and take a step back. Is there anything going on in our environment right now? Is there any changes going on? That's the first step. If there's a change going on, a new sibling, divorce, marriage, someone moving in, someone moving out, those can be some of the most common causes of symptoms in kids. And then really having conversations with our kids and teaching them the importance of communication, really getting down what's going on in school, what's going on in their social environment. And then going next to looking at the foods that they're eating. However, whenever there's a reason to be concerned, there's nothing wrong with discussing with your primary care doctor. Your doctors and your healthcare professional teams are really an extension. They're the ones with the training to help you understand whether this is just within that span of normal versus this is something that needs to be investigated further.
Yeah, and again, it's like a migraine headache. It's not going to show up on any test. And there are some simple blood tests that the doctor can do, such as a blood count and a test called C-reactive protein, which tests for inflammation in the body. And if they're negative, it's very reassuring, as long as the kid has no fever or weight loss. In addition, a lot of parents worry about sprue or celiac disease. It occurs in about 1 in 100 people, and there's a simple blood test to look for antibodies that might sort of allude to that. But it's no more common in irritable bowel syndrome than it is in the normal population.
What's the youngest patient you've seen with IBS? And in the case of a child, do they sometimes outgrow it, or do they have to look forward to a lifetime of suffering?
In our classes, we had an age range of 12 to 18 for the peds class. However, we often had people asking if their 8 or 9-year-old, 10 or 11-year-old could join. And we want it to be age appropriate, but certainly you can see, like many things, that we're seeing it in younger and younger kids. It's pretty common. Bellyache, is pretty common report, and then developing into the diarrhea, constipation, and altering usually comes a little bit later.
Right. Thank you. Could you talk a little bit about adaptability and what that means for gut health?
Well, it's adapting to your situation and attenuating the symptoms, controlling them with what you have in your power to do, such as relaxation and exercise and sleeping better. And I think, I think you made a great point. I really want to emphasize this. If you see a child with irritable bowel syndrome, you're seeing an adult with irritable bowel syndrome. I'm like Doc in the DeLorean in Back to the Future. I used to come to the parents and say, I'm not a pediatric gastroenterologist. I'm an adult gastroenterologist. But I'm here to stop your kid from progressing on. I'm not going to cure them, but I want to attenuate this condition by giving them tools to manage the condition. And once those tools are set into play and they work, that's something that those patients can use.
And helping the kids adapt in their environment, but also sometimes marriage counseling is part of the treatment plan, in the child's chart, that the parents are coming together where they aren't parenting different, where one is coddling or over coddling the symptoms and one is dismissing them. That's very confusing for the kids. So getting parents on the same page is a really important part of helping the child adapt to whatever they're going through at school.
When it comes to adaptability, I think a lot of children thrive on routine and structure. However, we have to also understand that we have to teach our kids how to transcribe and translate their systems from one routine culture to another routine culture. And sometimes what happens is when there's changes occurring, our ability to adapt to the changes that are external to us can also impact how much our GI health or how well our GI health does, right? So a lot of times we see people with GI symptoms when they're going through changes in life. That talks to our adaptability and our sense of that life is about 50-50 and not about perfection, and how to really translate and work on our mindset to help us adjust to whatever it is that's going on the outside, so that we're not internalizing it or viewing it as bad or dangerous or not normal. And so when it comes to adaptability, that's really important, being able to take oneself from one external environment or situation to another without impacting our sense of health.
One of the things I keep hearing about in the summit is the overuse of antibiotics and how that's not favorable to our microbiome. And it seems that antibiotics are being prescribed more and more these days and to younger people. So how can the use of antibiotics in young children negatively often affect their microbiome? Is this a good idea unless it's absolutely necessary?
It's a bad idea, and there is some evidence that it may predispose kids to Crohn's disease in the future, although long-term studies are always difficult to analyze. But having said that, yeah, you do mess up the microbiome, and there's a condition called Clostridium difficile colitis, that there's an overgrowth of bad bacteria that occurs in patients that take a lot of, and not everybody, but a lot of patients that take antibiotics, and it's treated with fecal microbiota transplants. And I've treated a patient with that, and it's very effective. So I think, I don't think it's good, but we don't know. I mean, I see the microbiome as the universe. We're just starting to prod up to about Mars right now, and there's a lot more that we need to know.
In adults with IBS, you often see a concurrence of SIBO. Is that also common in children?
In my experience, no. Again, I'm an adult gastroenterologist. SIBO is kind of a little bit less popular than it used to be because the tests for SIBO are very unreliable. They're breath tests, and they can be affected by a number of variables such as transit time and proton pump inhibitors like Prilosec. So I think it's hard to sometimes interpret the results. And I think it's a little bit over-diagnosed. People say, it occurs in up to 89% of IBS patients. And some studies have never been able to find it in irritable bowel patients. So I think it's a factor, and it may be a factor in people who have what we call post-infectious IBS. These are people who go to Mexico, come back, and they've still got the diarrhea weeks later. Maybe they're the people that can, are susceptible to SIBO. And if you treat everybody with IBS with SIBO, you'll get about a 48, if you treat everybody with IBS, assuming they've got SIBO, and there's a drug called rifaximin to do that, it only works in about 45% of patients.
I don't anticipate a lot of children watching the summit, but if one was and they had GI distress, what would you say to a kid?
That routine that Dr. Latifat spoke about, and all the exercise and meditation that Dr. Lawson mentioned. But also one thing we haven't mentioned is bowel training, where they wake up in plenty of time for school. Many of them are in the bathroom for a lot of that time. And so spending a little time regularly in the morning, having breakfast, doing something enjoyable, training themselves to go to the bathroom in the morning rather than kind of holding it throughout the day. And setting that up to be a relaxing place where their body learns what to do at that particular time of day can be part of the routine that helps.
So if you each could please answer this question and take as much time as you need, and whoever would like to go first, that's fine. What is the truth about GI health?
I would say that the truth about your GI health is that your GI health is not your enemy. And when you're having your GI symptoms, it may feel like it's the center of your world. It may feel like the only important thing that's controlling your world at that moment. But I encourage you to take a step back for a second and say that I have this life that's a gift for me. And if my GI health is this way, how can I live my life and still make it the best ever? And I think that's something that I want to make sure I pass on to people, where our GI health is not a burden to us or a curse, but it becomes part of our story, not all of our story. So that despite it, because of it, we can live our best lives ever.
Thank you.
I don't have too much to add to that. No longer seeking one answer to the problem of IBS and really looking at all of these things we've been talking about. We so badly want one pill or one surgery or, something that explains it all with one word. And we don't have that. We have something better that you can enter through a lot of different doors and end up improving your gut health and improving your general health.
Thank you. Dr. Lawson, would you like to finish it off?
Just reiterate what both ladies have said. I think that it's important, as Dr. Latifat said, not to make this the main focus of your life. We see patients that just ignore other things going on and affect their relationships because they're so focused about this bowel issue. And I think it's important not to ignore it, but to manage it, put it in its place, attenuate it to the point where it's, you know, it's always there and always will be there, and it will flare up in certain times. Accept that and just work on the things that control it, be it, you know, diet, exercise, sleep, stress management. Come to know the things that make you feel better and make your gut function in a relatively normal way.
Right.
And stay connected to the people that you trust. You know, for kids, talk to a trusted adult. If that's not your parents, it's someone else, and the family or friend. It's talking to other kids. It's staying connected and not isolating.
So there is hope that both children and adults can learn to manage their GI distress. Thank you so much, doctors.
Thanks.
Thank you.